Hi guys, it's Janae with Daily Dental Hygiene. Today's topic is going to be about GERD, acid reflux. What are the signs, the symptoms? Why is it important? How does it affect our teeth? And what can we do to protect our patients? So first off, let's get into GERD and acid reflux. I always like to first, when I talk about a topic, break it down and even explain the definition of it. So this is stomach acid that comes up our stomach, up our throat, and into our mouth. The pH of our stomach is very, very, very acidic, and it can 100% break down the tissue lining and the enamel in our mouth. So, huge increased risk for cavities and decay, sensitivity, and oral cancer. So, who is at risk for this? Pregnant women. A lot of people get morning sickness when they're pregnant. Patients that know that they have acid reflux and GERD, and patients that are bulimic and throw up food. So with this being said, what causes this when it's a medical condition like GERD or acid reflux? So a lot of times the sphincter that closes off our stomach is loose and acid refluxes back up. So your stomach has a flap that's supposed to keep that acid in your stomach where it belongs to break down food, but sometimes when our body doesn't work right, we can get that acid coming up our throat. People tend to have this when they lay down at night after a big meal. That's why you're not supposed to eat 2 hours before you go to bed. Most people notice this when they're leaning back and they're sitting back and they're laying back because the gravity is not as intense. If you're flat, it's easy for food to come up, as opposed to standing, and it would have to work a lot harder to get up your throat and into your mouth. So what are the signs and the symptoms? This is a photo of what acid reflux looks like. So do you see how there is a yellowing? There is a yellowing showing in the teeth. The enamel has eroded away. The layer underneath our teeth is called dentin. So the white portion of our teeth is enamel, and when we start to get acid erosion and acid reflux and GERD problems in our mouth, we start to see the inner layer because the enamel has been eroded away from the teeth. This is very serious because then you're at a very, very, very high risk of cavities, decay, and sensitivity. But the reason we see it when we're looking clinically at a patient's mouth, the reason we see it on the inside is because when you bite together, the acid is hitting the backs of the teeth first. That's why people that smoke and use tobacco, you don't see the staining as much on the front teeth. You see it on the inside because the smoke is hitting the inside teeth first. Same with the acid. So if you want to see if somebody's having stomach problems, take your mouth mirror and shine the overhead light and your loop light into the teeth to kind of transilluminate, to kind of see if you can really see that wearing, and you'll see like an edge of the enamel and the yellow portion like I showed you in that photo. This is important because esophageal cancer is huge. Your teeth are eroding away and you can see into them. Think about the soft tissue lining of your throat. Barrett's esophagus is a huge one, and this needs to be corrected. So it needs to be corrected, number one, with going to your ENT. You can go to a gastroenterologist. You can get studies done to see why you're getting this acid reflux, what is causing this acid reflux. You can get over-the-counter prescriptions that dilute the pH of the acid or help to your stomach not to produce so much acid. There's lots of different treatments. I'm not a medical doctor, so it's important to first get diagnosed as to what is causing this, so that you can really get to the baseline of the best treatment option. Is it that your stomach needs a surgery to close the flap better? Or is it that you just produce too much acid and so your body can't handle it? Get to the basis of it, get your specialty work done through your medical doctor, and go to a specialist to figure out what the root cause is. But that enamel erosion is permanent. So once we lose enamel, we don't get it back. And it's important to maintain the enamel that we have left. So really important to put minerals back into our mouth. Things like calcium, phosphate, and fluoride found in toothpaste, found in prescriptions that you can get from your dentist, and in your toothpaste. Thank you guys for tuning in, and please, please, please let your patients know when you see these types of things so that we can really get on top of it and prevent further wear of your teeth and prevent oral cancer, which is so, so detrimental. Take care, guys.